Hey everyone, Michael Dudley with In Good and Health. I have an awesome patient success story to share with you today between our care navigator Christy and her patient John Doe. The care navigator is at a very unique position to be at the right place at the right time and help a patient see a physician before it's too late. Now, as a background on In Good and Health, we are hired by primary care practice to reach out to their patients every single month and through education, coaching, and accountability, help these patients make lifestyle changes, ones that keep them out of the hospital. It's completely paid for by Medicare and other programs. Now, Christy's been working with John for the last few months, and they've built a really strong patient bond. So when Christy calls John in April, John feels vulnerable enough to share with Christy that he's been having some trouble lifting his left leg, and he's fallen twice in the last 2 weeks. John said he was going to just wait a month or two until he saw his physician next for his next appointment, but Christy was alarmed. She said, "Falling twice in the last 2 weeks is a little scary. I think you should go see the physician before then. Do you mind if I go ahead and schedule that visit for you?" And John agreed. So John's physician, our care navigators have access to the EMR of the practices we work with. So his physician had an opening the next day, so she went ahead and scheduled that, and John went that next day. So when Christy calls John in May, she found out that John was referred by that physician to a physical therapist. And since then, John's been seeing that physical therapist 3 days a week, and each day his leg's getting stronger and has not had an incident since. John thanked Christy for encouraging him to take his leg strength seriously and going for that appointment, and how thankful he was he had someone to help navigate his health. I know what you're thinking. Michael, this is a really simple story where you have a patient that needed to see a physician and the care navigator just scheduled an appointment. What's the big deal? Well, when we're thinking about risk, specifically fall risk, this is really, really important. A hip surgery could range anywhere from $30,000 to $40,000, but a visit much, much less. And so by having this care navigator identify this need before they would have seen the physician, they could have had 4 to 6 additional falls before they would have seen that physician. And Christy was able to help prevent that. One of those could have been breaking a hip and needing a hip surgery. So I know it's something simple, but these care navigators have an influence on these patients and can go ahead and schedule these appointments. And those physicians are really able to see high need situations to help them work at the top of their license. If you would like us to be able to repeat this same success with your patients, with your practice, we'd love to do so. You know how to reach me, but hope you have a wonderful day.